Hi, it's Michelle Turner from Movement Lessons, and I'm going to do a lesson. I know it look a little bit awkward, but it's actually for a friend of mine who's having surgery next week, and I just thought all of you could possibly benefit. So coming out of surgery, there's a lot of things that happen. First of all, you're dealing with anesthesia. Anesthesia, what it does is suppresses the body from responding. So I really try and go into it where you're breathing as naturally as possible before they ask you if you're excited or anxious, which I know is going to happen anyway because you're about to go into surgery. But let's say if your chest was like this, it's suspended like that. You don't go into a relaxed state. It's a suspension. So, and that being said, so the second you come out of anesthesia, and again, I'm in this awkward position because it's usually a hospital bed. They prop the pillows the best that they can find to make you comfortable, but again, it's usually not the comfortable position. Or what I'm trying to do is like if the bed was inclined here, and the same with the raised knees. So I swear I had my colon removed 4 years ago, and I was doing the pelvic clock. I was half conscious, and I was doing this the best that I could, just to start getting the anesthesia out of my system, to get my system hooked up again, to start going back to that familiar. And when any kind of trauma, I'm sorry, me personally, I go after that pelvis. So IVs, no IVs, all of that, I don't care, trach, mouth, resuscitate, all of this, there's no reason why you can't even visualize what I'm about to show you. So this is the pelvic clock. Imagine that you're laying on a clock. So the clock would be here. So I've got down at my tailbone, I've got my 6 o'clock, and up at my belly button, again, if I was laying on a clock, is 12 o'clock, 3, 9. So all you're going to do in this position is just tilt the pelvis towards 6 o'clock. And it's just a nice, easy tilt. And again, I kind of look like I have a big bear belly in this because I'm not lying flat, and even in this position, even with my head propped or whatever, just feel the spine. Just feel how the head is attached to the spine. Can you feel the heels of your feet from this position? Yes, it would be very nice if you could be in a lying down position, but in a hospital, it's not about movement. It's about saving your life and your care. It's not movement conducive. Let's put it this way, being in a hospital. I'm sorry. And that starts from babies on up. And just relax. And again, you could hardly see me doing the movement. And that's not the point. The point is I'm doing the movement. And even if you can't do the movement, just visualize it. Just visualize it. Where is your tailbone? Or what I like to visualize, like I'll do it again now, I'm going towards 6 o'clock, tilting. Just pretend like there's like a little troll under your bed, pulling the string from your tailbone. And just elongating the spine, tilting the pelvis towards the bed. Again, it's not about doing 25 of these. It's not about doing 20. It's about just being aware of your system. Any pain, discomfort, fatigue, whatever, stop, rest. And notice now, is your breathing better? Or is your clear focus? Are you more back into yourself? Because honestly, when you're on a lot of drugs, you're not in yourself. Your brain does not know how to speak to the body. And that's what you're bringing back, is that conversation. And now I'm going to tilt towards 12 o'clock. And the same thing. I like to visualize it the same thing. Like there's a little troll now under this side of the bed. Just pulling down my spine towards the bed. Notice that I'm not going into heavy contractions. It's not a force. Another way of looking at it, you'll see when we go from 6 to 12, it's just like a little boat floating on a little lake. You're just getting that tilt. And again, check in with yourself. Is there any kind of pain and discomfort? And there's going to be pain after the surgery, but this is a good time again for that self-awareness. Is the pain more than usual? Is it less than usual? Can you find that place of peace? Are there complications maybe that the doctors don't know about yet that you can articulate saying, listen, I'm getting this sensation here. Is this normal after? Ask questions, being in control of yourself. And again, maybe if I was functioning better, I would have maybe done this a little bit longer. But again, after surgery, I don't care if you visualize 6 of them, whatever. It's about just connecting and moving. And relax. And now with this, just from doing that, you might fade into sleep again. That's fine. Now you come back, and now I'm going to put the 2 together. So I'm just going to tilt from 12 o'clock into 6 o'clock. And even in this position, like I said, those with more of a trained eye will easily be able to see that there's changes in my body. And relax. Now, for those of you, if this is easy, you can go more complex now and just go tilt down to 3 o'clock. For those of you, maybe you've never done this before, and you're just coming out of anesthesia, stick to 6 and 12, that's fine. I'm just, again, as if someone is pulling down, just going to my 3 o'clock. And also you might feel that I'm rushing here. This is slow to a 10 times slower. And again, just feel also how maybe if it's that minute that you are moving without pain, even after surgery, versus, you might have pain here, but you'll start to, the intelligent brain will say, oh, but I can do this. This is great too when you know it's time for bed or in the middle of the night, there's no specific time, and relax. The reason 3 and 9 are really, and the whole clock is also important for when you suddenly have to get up. It's that tilt. Now I'm going to go to 9 o'clock. It's that tilt of the pelvis. That can go over and get you out of bed. And rest. And now 3 and 9. I mean, you don't have to be coming out of the hospital. You can do this camping in a tent somewhere. It's a really wonderful little movement to know. If you're good at it, and I'm going to show you sitting up in a second, you can do it in a car, when you're a passenger or at a red light. And again, these would be quickies. Boop, boop, boop. But, so now, like I said, I'm going to sit up. So in this position again, I'm pretending I'm in a hospital bed. So obviously I'm not laying on the clock anymore, but I'm in sitting. So in this position, and again, it's just about that rolling your pelvis, and that's all I'm doing. It's like I'm rolling. This might feel more that I'm on the sit bone myself, or I'm rolling it, and I'm just rolling towards 6 o'clock. That's it. And again, I'm talking to you and doing this. I can be talking to my Aunt Mary doing this. It's there's no difference between doing this and a physical therapy, or getting ready to go out. Look at how it too will help your bowels start to function again. Painkillers are all affect constipation, bladder functions. They don't let you out of the hospital until you do these things. Look at the benefits besides just moving again, of hooking up to the system. And relax. And now tilting back is going to feel a little bit different. You'll probably, again, it'll be a lesser movement. Doesn't have to be. But notice how I'm not like this and contorting. It's just, all I'm doing is bringing the pelvis back. And here I just look at the pelvis, my pelvis like a big old fruit bowl, you know, it's just, so I'm just bringing it back and then I'll rest. And again, I can gaze the room while I'm doing it. It doesn't have to be a Zen type thing. And now I'm going to combine the movements from 3 to 6. Sorry. I'm going to combine the movements from 6 to 12. You can do a movement, just say from 3 o'clock to 6 o'clock, but right now it's 6 to 12. And relax, and you'll feel how the heels are incorporating, the thighs might be incorporating, again, how your breathing is getting softer, the chest. You'll probably see your blood pressure go down on the monitors. That's what's neat about being hooked up in the hospital and doing these kind of things. You can watch how your respiratory and oxygen intake changes, and they always improve, by the way. They should. If they don't, then something else is going on. So now I'm going to just go to 3 o'clock, and then again, it's just and might be that you notice that you have more freedom, let's say in this position, because you have more participation in your chest cavity or whatever. It's easier. And maybe if it's easier sitting, then you'll realize it gets easier when you lay down. And then I'll rest. Of course, it helps when I have the ball here. The way these balls are great to have in the hospital too. You can wipe them down for germs afterwards. And now I'm going to go to 9 o'clock. Just to show you from 3 to 6 to 9, going around. You can do a full circle, is much more complex. You can do the circle the other way. You know, again, that's when we're getting into more complex movements. If all you're doing is from 6 to 12 though, brilliant. And now I'm going to take this away and just show you the benefit. One of the big benefits, again, is getting up. So I'm taking away my bolster. And just notice in this position, now most people would grab. They go for muscles. Think from your pelvis. Your pelvis just rolls. I'm going to 9 o'clock. I'm going to 6 o'clock. And I'm up.